County Health Director, and we're so thankful to have you on board this morning.
Good morning, Ellis County, and really all the listening areas. So, COVID-19, it feels like, I told them this morning, it feels like it's been forever since we've been here, but it feels like this year has taken forever, especially for most people. So, as we look at what has happened, really since the last time we've been here, we have seen case increases really across the nation. We've seen case increases in Ellis County. We've also seen case increases in Kansas. I looked this morning. As you look at the hospitalizations and the and deaths, which unfortunately is the worst case scenario from COVID-19. So as we look at those, actually, we're still seeing a pretty sharp decline in both hospitalizations and deaths across the state from where we were at the peak in March. So in Hayes, we've thankfully we have 7 active cases as of yesterday. 7 active cases today. The numbers are the numbers will actually be less. We have a couple people that are going that will be back in recovery. So we have 7 active cases. We have thankfully had 0 deaths at this point, and it's those are good numbers for us. Those are optimistic numbers. As we look to the future, I think it's fair to tell everybody we will see cases increase. They're with viral transmission, a virus has really only 2 things that it does. It spreads and replicates. That's its only primary function. So as we see that, we will see cases increase. Right now, nationwide and in the state of Kansas, we see a predominant amount of cases in the population under 55. So 76% of the cases in the state of Kansas are in the under 55 category.
Oh, that's interesting.
The good thing about that number is that the predominant amount of deaths is in the population over 55. So 93% of the death toll in the state of Kansas, which is around, I think there was right around 280 deaths as of yesterday. 93% of those have been in the population over 55, and almost every single one of them has at least one pre-existing comorbidity, means that there's at least one other cause of death on their death certificate. So as we look at those numbers, the good thing about that is that the highest mortality is in the population that doesn't have the highest case count. So keeping it that way, staying with that dynamic is really impactful in reducing that mortality index. And that's why we've seen across the nation, we've seen cases significantly increase without a subsequent increase in mortality index. So those are at least positive numbers, I guess.
Yes.
When you talk about deaths, it's hard to say that anything is positive, but at least mitigating and limiting that is really important.
Yeah, I appreciate you saying that because you hear in the news and you almost want to go to stark raving panic, right? But to hear the hospitalizations, it's a fun word. That those are down, right, and the deaths are down. And then what also saw today that we're like 185,000 negative tests overall.
Yeah,
that's really good, right?
Yeah, the state of Kansas actually, and if you look specifically for Ellis County, we're in the upper third of testing per capita. So. With all of this, we generally with viruses, things like that, we look at it as cases per 100,000, or we always look at it as a way to statistically compare you to a bigger city, to a smaller city, to compare really population size. So if you look at our testing rates, if you look at our case rates, actually our case rates per capita are actually are low, or on the low end, are percent of positive, which is the important part with case growth. So we look at, Florida, the national news media loves to catch on to one minor study or one minor story, and they like to play it all day, and it really does seed a lot of fear. As you look at our percent of positive in Hayes, we actually have a really low percent of positive, really nationwide, and for even in the state, we have a 1%, it's 1.5% percent of positive right now, which means that the number of positive tests that are returned across the number of tests given is actually really low. The important thing about that number is it shows that's a way to statistically see if your cases are significantly going up or if it's a balance between your testing increasing and your cases increasing. So in Hays, specifically in Ellis County, we do see more cases. The cases we're finding are not just because we're testing more. We do have more cases, and we have symptomatic people. We do have viral transmission. We do have everybody's concerned or fearful of community transmission. Yes, we have cases that have acquired it probably in our community. The predominant amount of our 30 cases, though, have gotten it from somewhere outside of Ellis County.
Yeah.
So travel, all of that kind of stuff, you're putting yourself at risk if you go to an area that has more transmission than we do. Now, does that mean that you shouldn't do it? Does that mean that well, if you look specifically from a laboratory scientist aspect, if you say, is traveling a good idea? No. But you have to make your risk assessment. You have to determine if the risk of that event is worth the outcome for you, your family, and the community. And so as you look at that stuff, we have to make those decisions for ourselves. It really does come down to individuals making the choice to protect themselves. And the more we protect ourselves, the more we protect those around us. So Hays in Ellis County has an extremely low percent of positive, 1.5%. If you look at the statewide, I think it's around 5% of positive. And then where the KDHE says they get concerned about other states is around 8%. So at 1.5%, we do have a low transmission rate, basically. And so those are good numbers. And then obviously we want to continue testing. Right now, the KDHE and CDC are still not. They're still not encouraging or requiring asymptomatic testing. They actually, if you're symptomatic, obviously contact your primary care physician when we get you tested. But as far as just population studies with a PCR test, we've talked before about limitations of testing, and it really does just show you that snapshot in time. So that's why the symptoms are so important.
Yeah. Wait, that's with Jason Kennedy, the Ellis County Health Department. More to come, Jason. You're going to hang out for a
Sure.
little bit. As we head back into Toby Mac, this is Love Broke Through on KPRD.
Matt Marr on KPRD with Alive and Breathing. Thank you for listening to your local Christian station, KPRD. Dave Beverly and our special guest, Jason Kennedy, Ellis County Health Director, with us this morning.
Yeah, Jason, always appreciate you stop by and come and talk to us. To be able to connect on what's happening in the world right now and how it relates to our county seems pretty key with COVID and everything. You hear a lot of different things in the news. Facebook, you hear even more, and can be kind of intriguing. So to get your take on it as the health director in Ellis County, we really appreciate that. So thank you so much.
Sure, absolutely. Anytime we can educate. So we've talked about this before. The primary function of our office really is to educate, and so. As we get those opportunities, I think it's great. And we've also talked about this before. A lot of times the best source of information is not Facebook.
Yeah.
It's a lot of times there's significantly better sources of information out there. And so making sure that we're giving good information and that we're giving factual information is extremely important.
Yeah. Well, the big talk right now, the big debate, I guess you could say, is masks, right? Now, we've all heard all kinds of varying views on masks. Now, was it last Thursday, you gave us kind of the instructions for Ellis County. Of course, you'd have to look at your instruction per your county and what your county is doing. But I don't think any county here locally is taking on the mask mandate that I can recall.
Right.
Sure. Yeah. Masks, unfortunately, have become an extremely hot topic item, extremely divisive in our community and in between individuals, even, national level. And so it's masks are what we need to remember are that masks are part of a wider spread community mitigation measure. So these measures include everything that we've talked about from the start of this. They include social distancing. They include washing your hands, disinfecting common use surfaces, not touching your eyes, nose, or mouth. And then the mask use has been a more recent addition to the community mitigation measures. So as we look at those community mitigation measures, we need to remember and we need to understand that community mitigation measures only work if they have widespread adoption. So that means that you need to have 90+% of your population that's willing to adopt those community mitigation measures for them to truly be effective widespread. And so as we look at social distancing, I think that's one that everybody can get behind and say, okay, I can do my part for that. I think we have had fairly good success with social distancing in Ellis County. We've talked about this from the start, in that we are inherently socially distanced out here. It's if I'm in New York City, my neighbor might be 6 inches away from me. I share an elevator with 24 people every morning. I share a subway car with a few thousand people every morning. It's out here we don't have that. So that community mitigation measure is a little easier to implement and a little easier for people to understand. When I'm at work, actually really all the time, I'm try to be more than 6 feet away from people at all times. I just do. It's and it has nothing to do with social distancing. I was like that before. I think most people are like that. It's unfortunately for the people that are in this group, but we do have what we call them close talkers. So you have the person that like comes right, they're like right up in your face, and it makes everybody nervous, and you can see it. They start backing off. Well, I don't know if that's a Midwestern thing. I don't know if that's a Kansas thing, but it's definitely something that is normal for our community. So that inherent social distancing is easy to adopt and something that we should continue to push. Washing your hands. Actually, unfortunately, that's an easy one for people to say they're willing to adopt, but we probably didn't do it enough, period. That's kind of an easy one that public health has been preaching for a long time. It's good all times of the year, and it's good especially if you have those little germ factories in your house like I do, which is my kids. Really encouraging them to wash their hands, and you washing your hands a lot. So again, another easy one to adopt. Not touching your eyes, nose, or mouth. We've talked about that before, how difficult that one is. You would think that would be an easy one to adopt, but it's something, the more I tell you, the more you want to touch your face. So
I do kind of want to do that right now. Yeah. I have an itch right around the nose. I'm really resisting.
And then cleaning and disinfecting common use surfaces. So this is one that honestly we need to be careful with, especially with younger kids, about sterilizing the environment completely. Because these kids, as their immune systems are growing, we do need to be careful that we don't sterilize the environment for them to the point that they don't have those immune responses early that help to build that immune system. Now we get to masks. So masks are the new addition. Public health has gone back and forth, not so much our office, but really at a national level. The initial push from CDC and KDHE was that you don't need a mask. Then they came out and said, well, you can wear cloth masks. And then we did see the mandate. Obviously, Ellis County rolled that mandate back at the county commission level. So following about a month ago, the legislature passed House Bill 2016. So what House Bill 2016 did was it basically pushed authority back to the local level, in that the county commission or the county board of health, in most counties, the county commission is the county board of health. That county board of health or county commission can roll back executive orders. They can impose less restrictive measures if they feel it's a necessity. So as we look at masks and we look at the divisiveness of masks, from a public health standpoint, there are studies to suggest that masks work in certain environments. Those environments are in high population dense areas with high viral load. So what that means is that masks work inside a home with somebody that has COVID-19. They work in healthcare settings. They work in those enclosed environments where you have high viral loads. So where you have a lot of COVID, they do help to limit some risk. There's a big push from public health officers and public health officials for masks in general public, as far as a community mitigation measure, just everyone in masks anytime you're outside your home. The data on that is mixed. It really is. As far as whether they work, whether they don't work, we don't have reliable data to show that a wide population of healthy individuals. Like I said, in Ellis County, we have seven active cases, which means we have 28,000 people that are healthy right now or don't have COVID. So what the studies haven't shown is that how those work as a community mitigation measure with a healthy population. And so the data is mixed. Do masks work? Absolutely. Do they work as a community mitigation measure? We're not 100% sure. What the CDC says is mechanistic plausibility. That's their definition for why masks work or what their justification is. And what mechanistic plausibility is basically it means that the cause is based in science. So in this case, the use of masks is based in science. We know that through chemistry, physics, and we look at biological transfer, stuff like that, we know that by limiting the distance a droplet can travel, we think, because of science, that limits the amount of viral transmission. So as we look at that, masks work in for sure in a high density, high viral load environment. As far as on the street, there's mechanistic plausibility that says that they work because they limit that droplet spread. Now, what's in question and what the fear on both sides of this drives is we need adoption. So for them to be effective, we need to have high adoption, and we need to have a high adoption rate across our community. If this order, as this order was rolled out, I do not believe we would have seen high adoption from the general community. So as we look at community mitigation measures, if we issue them too early, or we issue them to a population that doesn't believe in them, we won't have adoption. And if we do it too early, they talk about all of the pandemic plans, even our Ellis County pandemic plan talks about if you issue these orders too early, you get what's called alarm fatigue. People will get tired of utilizing the measures before you need them. And then when you go to reissue them, they will not follow them.
So the boy who cried wolf.
Yeah, unfortunately that story holds true from the time you're little till now. Mm-hmm. And so as we talk about the use of masks, if we need them, if we need that order, we need people to understand and trust that order is based in science, it's based in the numbers, and it's based in the facts that we are presented now for Ellis County. And I think if we win that battle, we will have high adoption rates, and they could be successful if we need them. But right now, they would not be included in part of our pandemic plan that was written far before COVID. Our pandemic plan was actually written after H1N1. We look at it every year. We update it as necessary. This is not a community mitigation measure that's included in our current pandemic plan. Mm-hmm. And so, do masks work? Sure. Do they work widespread? We're not sure. Are they an extremely divisive and something that just should not seed the fear and doubt in each other? Absolutely. There is no need for the fear and doubt. There is no need to say that someone doesn't care about you because they don't wear one or because they do. We should view each other as human beings. We should view each other as individuals, and we should say, listen, I make the choice to wear a mask to protect you. There's actually, everybody keeps saying I wear my mask for you, you wear your mask for me. There's actually some studies to show that the mask does protect the wearer. And again, you look at mechanistic plausibility. If it'll cut down on droplet spread out, it would cut down on droplet spread in. So there are some studies even to defend that there is some of that particulate filtration on both sides. Now, widespread community mitigation measure, we really don't know in a population of healthy people. We keep viewing these mathematical projections. Mathematical projections show this kind of decrease or this amount of decrease or that amount of decrease. The mathematical projection on mask use in widespread communities comes with data from New York. We use subway data from New York to show the mitigation measures in Kansas. That data is not fair for Kansas. That data is not fair for Ellis County. We are not New York. If you look at population density and viral transmission, viruses spread faster and more widely in a population dense environment. Right now in this country, if you look at the 8 most population dense states compared to the 8 least population dense states, you're 4.3 times more likely to contract it in the population dense states and 12.6 times more likely to die from it if you contract it in the 8 most population dense states. Because you're packed into subway cars, you're packed into elevators, you're packed into apartment complexes that share the same air handlers, air exchangers, and all of that kind of stuff. Mm-hmm. Viruses spread person to person. Less people, less spread. And so as we look at these measures and as we look how they impact Ellis County, We need to start with what is Ellis County and what are the counties in western Kansas? What do we look like? What is our makeup? What is the population that we need to impact? Which is why nursing homes are still more restrictive. Nursing homes will continue to be more restrictive because they have high population density and a high number of at-risk patients. You look at communal housings, things like that, they will continue to be more restrictive. Measures that make sense in there might not make sense in the normal environment. But specifically with mask use, if you wear a mask, good for you. Just because someone doesn't wear a mask doesn't mean they don't care about you. You take measures to protect yourself, they take measures to protect themselves. The best thing we can do right now is socially distance and avoid mass gatherings or any event where you cannot socially distance. Look at bars, nightclubs, look at the clusters, the outbreaks from all of those that we've seen. Church gatherings, unfortunately, I know this is, I know that's tough for some people, but as you look at those church gatherings, weddings, funerals, all of those, we go there to interact with people, especially church gatherings. Can you imagine a church gathering if every single person was like 8 feet away from each other and like that's not what a church gathering is. You go there to you go there to talk, you go there to interact, you go there to have that part of society. Now, you go make your choice. Make your choice to go to that, make your choice to protect yourself, try to implement that social distancing. And if you can't implement social distancing, the recommendations are to wear a mask.
All right. Well, that's great information. And what was that term again? Mechanistic plausibility.
It's a fun word.
Yeah.
Hey, thanks so much for tuning in, Jason. Thanks for hanging out with us here this morning.
No problem.
You're listening to KPRD Hayes 88.9 as we head into the top of the hour, National World Headline News.
KPRD on your Tuesday morning, Rend Collective and counting every blessing.
Hey, Bev, Dave, and our special guest here with us. We got Jason Kinney from Ellis County Health Department. Jason, thanks for coming in and connecting with us on various health measures regarding COVID and things we need to consider as we interact in life in the COVID world that is still ongoing. It's still going on, Jason.
Yeah, absolutely.
I wanted this to be over by April.
Yeah, I think everybody held out hope that as we got to summer months, it would go away. Obviously, COVID is still with us. We see an increase in cases. We see increases in testing. We see increases in restrictive measures really across the nation. So COVID obviously is still with us. It is a very real virus. It is a very real part of society right now. And the choices that we make individually truly do impact the overall process or progress of the virus. So making sure that we make those good choices. One of the things that we get a lot of questions about in our office is one of our functions of the pandemic response is contact tracing. So there's been a lot of publicity or a lot of news media coverage about contact tracing, about lack of contact tracing and all of that. So we get a lot of questions about, by the way, Ellis County has plenty of contact tracers. We've trained, we've partnered with the EMS service. Which I'm thankful that I get to be a part of that as well. So we've partnered with them to bring on some contact tracers, train some contact tracers, and then obviously all of the Ellis County Health Department staff has done a phenomenal job of cross-training and redirecting from whatever their primary role used to be to still fill that primary role and take on the additional role of contact tracing and investigation and really just have done a phenomenal job of becoming a community resource for COVID. So I got to give a shout out really to both organizations that I get to be a part of, Ellis County EMS and the Ellis County Health Department throughout this entire pandemic. Both teams have just done a phenomenal job of stepping up to the plate, filling the need, and doing whatever it takes. They're continuing to do their regular job and taking on this pandemic. So as we talk about the contact tracing piece, there's tons of questions and everybody's nervous. So I was by someone, or I saw on Facebook that someone has COVID and I knew their brother and their brother was by them and I saw their brother 6 months ago or was in a Facebook picture with him. So with contact tracing and with COVID-19, we're all fearful of whatever. Everybody's fearful of something with this. Whether you're fearful of the virus, or whether you're fearful of the response to the virus, or whether you're fearful of the economic fallout, or you're fearful of losing your business, or you're fearful, all of those things are valid fears. And if we tell people the virus isn't real, it absolutely is real. If we tell people that the fear isn't real, it absolutely is real. But the contact tracing piece is something that you really shouldn't be fearful of. We will notify you if you have been determined to be a close contact of a laboratory-confirmed COVID-19 patient. You will get a phone call from our office. You will be mandated quarantine for 14 days. The individual that tests positive will be mandated isolation. So, contact tracing, how does it work? We start at the source, so whoever tests positive. We go back 48 hours, 2 days, because our fear is this asymptomatic or pre-symptomatic spread, which actually the CDC, KDHE, and most studies have dialed back the fear of asymptomatic or pre-symptomatic spread. They actually show extremely low numbers of that, maybe 3.3% as far as basic community spread with asymptomatic people. The reason for that is you have to get the virus out of your body, generally through coughs, sneezes, something like that. Then it has to be forced. Is it possible through general talking? Yes. Is it possible for someone to do it when they're asymptomatic? Yes. Is it likely or probable? KDHE, CDC don't think so. The studies don't really think so. There is a possibility though. So national news media, they like to grab that possible word, and they like to say, oh, this is happening. Well, we don't know. But we go back 48 hours prior to either the onset of symptoms, because symptoms are so important. We go back 48 hours prior to the onset of symptoms for that pre-symptomatic or asymptomatic period, or we go back 48 hours prior to test if you were never symptomatic. So if you were tested as part of a procedure, or if you were tested for whatever reason, we go back 48 hours prior to that. We start walking your steps forward. So anyone in those 48 hours prior to, up to the day you go into isolation, we see who you were in contact with, who you were within 6 feet of for greater than 10 minutes, because you do have to have that duration to build enough viral load. We do not count intermittent contact, walking past someone. Even if you walk past the same person multiple times in an outdoor environment, they were on the sidelines, you were on the sidelines of a game, and you were pacing up and back and forth on the side because your kid was playing goalie. Even if you pass the same person 10 times outdoors, if you did not have that extended duration contact, that face-to-face conversation for an extended period of time, it is very unlikely that you have contracted COVID from that instance. Now, if you don't take basic precautions, you can get COVID from pretty much any other contact. So we need to take these precautions all the time. But that intermittent contact, that back and forth passing, is not considered contact. Now, if you had an extended duration conference or a talk or something like that, so that greater than 10 minutes, you would be determined to be a contact. We would notify you from our office, and you would be mandated quarantine for 14 days from that date of contact. But we only go back 48 hours prior to onset of symptoms or prior to test date, because the latency period of the virus is really the 2 to 14 day period. So it's not likely you can infect someone until 2 days after your initial contact, and then most likely you are symptomatic if you are going to spread the virus. So we start walking your steps forward. We will notify anybody that you had contact with, meaning you were within 6 feet for greater than 10 minutes or an extended duration of time, generally in an enclosed environment. Now, if you're 8 feet away at a game and they were in the bleachers or the stands, it's not likely that you're going to contract it from that event. Therefore, you would not be notified. However, we need to all take precautions at all times. Monitor yourself for symptoms. If you become symptomatic, contact your primary care physician and work with them to determine the course of treatment.
All right. Wow. Good information and a reminder of that, how that contact works and what are the ramifications for that and the framework of it. So that's such a good information to take away and to live out, keeping that distance and not touching hands, nose, mouth, and wearing a mask if you feel necessary.
Hey, thanks so much, Jason, for coming in and hanging out with us today.
No problem.
Yeah,
It's, everybody needs to make the choices to keep themselves safe. The best thing we can do right now is socially distance, really avoid those mass gathering situations where you're around or where you're going to have close contact with people, and wash your hands and continue with life in a safe manner.
Very good.
But
Very
continue with life.
In a safe manner.
Hey, we got Francesca Battistelli, this beautiful, beautiful, coming up on your forecast. We'll also get into the Bible teaching program, A New Beginning with Pastor Greg Laurie. All that here just ahead. Praise Radio for Midwest Kansas. Good morning.
good. Yeah, good morning.